Congratulations and welcome to the BeVigilant OraFusion System. The OraFusion System is to be used by qualified healthcare providers on patients 22 years of age or older to enhance the identification and screening of visible oral mucosal abnormalities. A qualitative screening result is generated by lateral flow immunoassays along with clinical risk factors. The BeVigilant OraFusion System is complementary to and is intended to be used in combination with a traditional visual oral mucosal examination as an aid in the assessment of oral cancer during routine examination. It is intended to assist in the decision regarding referral of the patient to a specialist. The test is not indicated for use in patients with an active cancer diagnosis or an infection or fungus in the mouth. To get started, open the BeVigilant Reader box and remove the components. The components include the BeVigilant Reader, the instructions for use, and power supply, including the electrical outlet adapters for your particular region of the world. Prior to powering up the BeVigilant Reader, be sure to carefully read the instructions for use, which contains information about the safe and effective operation of the reader. After you've thoroughly read the instructions for use, it's time to power up the reader and set up your account. Press the power button, located at the back of the reader, and hold for 1 second. It will take the unit up to 30 seconds to fully power up and display the home or login screen. The unit must remain on a flat surface for the duration of the test. Select the language to be used on the device. Select the time zone where the device is used. Review the privacy policy and tap Accept. Tap Continue to proceed. Review the terms of use and tap Accept. Tap Continue to proceed. Now connect the reader to a wireless network by selecting the network, entering the appropriate network password, and tap Connect. Create an account for the practice by entering the practice name, email address, and password. Enter the password twice for confirmation, and tap Create Account. An automated message with a verification code will be sent to the email address used to create the account. If the email is not in the inbox, be sure to check spam filters and junk folders to get the verification code. Enter the verification code in the reader. When the correct verification code is entered, the reader will prompt the user to create a 4-digit PIN to expedite future login. Re-enter the 4-digit PIN to confirm. Setup is now complete and the reader is ready to begin testing patients. After you've set up your account, each time you power on the device, your PIN will be requested. When entered correctly, you will then be taken to the home screen. Make sure the PIN is documented for future use. To begin a test, press New Test on the reader screen. Confirm that the patient has a visible oral abnormality. Tap Yes. Tap Continue. The reader will generate a test ID. It's important to write the test ID in your patient chart, as this test ID is the only identifier that will allow you to access the patient's results in the future. It's now time to enter the basic information. Using the keypad, enter the patient's birth year. Next, select gender and tap Continue. You'll be reminded once again to record the test ID in the patient's record. Tap Next. You will now enter the patient's clinical factors. By selecting the information icon to the right of the list of risk factors, you can see the definition associated with tobacco use. Once you've determined the patient's current or former tobacco use, tap Yes or No. The next clinical risk factor is alcohol use. For a definition, click on the information icon. Now tap Yes or No. Next, please answer Yes if the patient is currently being treated for an active cancer diagnosis. If they do not currently have an active cancer diagnosis, please tap No. An active fungal infection could also cause an unreliable test result, and therefore, if your patient has an active infection, the test cannot be conducted. Determine they do not have an active fungal infection and tap No. Next, tap Submit. It's important to the accuracy of the test that your patient has fasted for a minimum of 1 hour prior to providing a saliva sample. Fasting means nothing in the oral cavity for 1 hour, including mints, toothpaste, smoking, or vaping. Confirm the patient has fasted for at least 1 hour and tap Yes. Please wipe all substances applied to the patient's lips, example lipstick or lip balm, before performing saliva collection. Tap the confirmation that there is no substance applied to the lips. Tap Continue. When you are prepared to perform a test, open the box containing the test cassettes and collection devices. Remove 1 test cassette pouch and 1 collection device. Use the Aura 3D immediately after opening the pouch. Once the sample is expressed into the sample dropper, it's important to inspect for any traces of blood. If blood is present, the test cannot be completed. Another test can be completed once the bleeding has been controlled. If no blood is present, tap No and tap Next. Now unscrew the dropper cap from the sample dropper nozzle. It's possible that some saliva may flow without pressing the dropper tube. Ensure cleaning supplies are available if needed. Now deposit the saliva sample onto the test cassette. Add 4 drops of the sample into each well of the test cassette, 8 drops total, by squeezing the tube. It is important not to exceed a 60-second time frame between dropping the sample into the cassette and beginning the test. Place the test cassette into the positioning tray on the right side of the BeVigilant reader and slide the tray into the reader. Keep on a flat surface. Do not lift the reader or the positioning tray. The positioning tray and cassette have arrows indicating the direction of insertion. Review the patient clinical factors. Are the clinical factors correct? If so, tap Yes. Continue. If not, tap Go Back to enter the correct information. Now tap Start Aura 3D Test. The reader will begin a countdown to let you know when the test will be complete. You can continue treating your patient while the test is running. Upon completion, the reader will emit a tone indicating the test is complete and display a test result of Monitor or Investigate further. A result of Monitor suggests there is not an immediate need for a specialist referral. A result of Investigate further suggests further evaluation through a specialist referral. With the result displayed, you have the opportunity to email the test result to the address used to register the BeVigilant reader by tapping the Email Results button. When you tap Go to Homepage, the reader resets to the homepage, and once you've removed the used test cassette and disposed of it according to local, state and federal waste disposal requirements, it is ready for the next patient. Thank you for your commitment to be vigilant in the early detection of oral cancer.